Hello everyone! Today we're going to talk about dental implants. Have you ever lost one of your teeth and there is a void that affects the shape of your face and smile? Has the process of chewing food affect you a lot as a result? Dental implant surgery is a procedure that replaces tooth roots with metal, screw-like poses, and replace damaged or missing tooth with artificial teeth that look and function much like the real ones. Because they fit, feel, and function like the natural teeth, dental implants are quickly becoming a new standard in tooth replacement. During this video, we will explain to you everything related to dental implant process, the reason for resulting to it, how it is performed, and what are the expected risks and the surgical procedure. Our role today is to answer most of your questions regarding dental implants. Today we have Dr. Lee, who is a leading doctor at Good Life Dental Hospital. He is going to discuss with us everything about dental implants from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Lee, how are you?
Hi, fine.
Thank you so much for coming. Can you introduce yourself to our audience?
Hello, my name is Lee Sang-min. I'm a dentist in Korea, and I run my dental hospital for around 9 years.
So can you tell us why is dental implant needed and why is it better than bridges?
Okay, actually, this is the situation that we have tooth is missing or the entire teeth is missing. Then we can consider between the bridges, the conventional way, or the dental implants. The advantage of dental bridge is the period. It consumes a short time, around 1 week to 2 weeks. However, we have to make the damage, we have to make the reduction for the healthy tooth. But the implant is solid. It just make a new tooth for the missing area. So basically, the dental implant is way better than the dental bridge.
So what is actually an aesthetic treatment?
In dental fields, there is some ways to make your tooth beautiful, like pretty and white. The bleaching is the tooth whitening procedure, but the dental bleaching has some limitations. For example, if you got some treatment, that tooth is not covered for the dental bleaching. And the second aesthetic treatments we call the veneers, aka laminates. Third one about the aesthetic treatments is all ceramic crown. All ceramic crown is needed if you got the root canal, the endodontic treatments, or the heavy caries, or if you have to correct. We are regarding this aesthetic treatments.
So just now you have mentioned laminate and crown. So
yes.
Can you tell us more about the difference between them?
The laminates is the same way. We just cut the frontal layer, just 1.1 to 1.7 millimeters of the surface of the frontal tooth and get some veneers to attach it. Then your tooth looks white and aligned. However, if you have already a caries or cavity on your frontal tooth, or if you already received a caries treatment such as the crown restoration or the resin restoration, then the veneer, the laminate, is impossible. Also, if you want to make your frontal tooth going inside or the heavy rotated tooth make line and white, also laminate is impossible. In that case, we recommend a all ceramic crown or crown. Crown restoration procedure, we can make a dramatically and align and white aesthetic appearance for a short time. However, the crown restoration almost need a root canal like endodontic treatments, but the success rate of root canal is around 80 to 90%. You have to choose a rightful and good dental specialist for your root canal.
So what are the important checkpoints while choosing implants?
There are so many factors you have to consider. The first point that choosing implant for a dental surgeon is the stability. That's a medical device which is going inside your body, so we are not recommend the brand new dental implant, but we do recommend an implants for like 10 or 20 years of long-term stability data, then we will use it for a very special care for the cushion. And also the second one, that actually this is embarrassing for the dental specialist, but there is no perfect design of the dental implants. It's customized for the patient's situation and choose the rightful design and the brand. The third one, there's a complications about the implants, even though a lot of patients is focused on the dental implant procedures for the pain or the money or the periods before the insert implants. But the important thing is after the surgery, after you get a crown, that is the matter actually. After 6 months later, the dental hospital's procedure is over. That is the most important thing for the patient's life. The dental implant, which is made in titanium, which is for the air shuttle for the universe, sometimes it is tearing, it's breaking down inside your bone. So the third thing that we have to mention is the patient's chewing power and the brand's titanium strength. That's the things that I want to emphasize for choosing the dental implants for your better life.
So, doctor, when do patients need bone graft actually?
The patients already knew before come to the dental hospital. But regarding the bone graft is unpredictable for the patients. Dental implant is surrounded by the healthy bone. That's the basic principle. So if you touch your missing tooth area, the outside, if the gum is going inside, if you're touching with your fingers, then you need a bone graft. But also there is some very unrevealed and forbidden space we call the sinus, the maxillary sinus in the zygoma. Inside here, the human has an empty space. The size of space varies for it's not determined by the ages or the sex or the nationality. It just varies. So we only can tell by the X-ray or the CBCT. And so the basic principle is the dental implants need surrounded by the sinus. Is we have to the add for the bone for if the bone in the sinus is under 8 millimeters, we need a sinus lift. And if your bone level is under 3 millimeters, then you need a severe surgery for the bone sinus graft. Sometimes you need a delayed implant. Delayed implant means the bone graft first, and 3 or 6 months later, and the dental implant insert later. If your bone and sinus is under 3 millimeters, that's a hard surgery.
Okay. So why do patients need to have a dental nerve treatment, and when should they have it?
Okay. Dental nerve treatments, it's a root canal treatments, and the special term is endodontic treatments. So sometimes the patient needs a root canal. There are a lot of reasons. Most of the reasons is because of the decay, the cavity or caries. If the caries is severe, it's going inside, it's penetrated, going to the deep inside, and the inside of the natural tooth, there is a dental nerve in the tooth. So if the decay is going inside, the nerve is get hard and nerve is get the troubles. So you have to remove the dying nerve and fill with a good material inside that we call the root canal. But it's not easy for the root canal for the dental surgeon because the success rate of the root canal is around 80 to 90%, even though this is the articles from the United States for the root canal specialist, we call the endodontist. But there's also the success rate in the USA endodontic specialist is around 80 to 90%. So it's not easy for the root canal treatments. If you have failed with dental nerve treatments root canal, we do have three alternatives, three repair plan for the root canal. The first one is the re-root canal, like re-endodontic treatments. And also the second one is the apicotectomy. Apicotectomy means it's like a surgery for the tip of the root and just cut the root of the tip using a microscope. And the third one is the replantation. The replantation is extract the natural tooth and put it inside within 5-10 minutes. So basically, the root canal treatment is saving the tooth procedure.
So, doctor, can you also tell us the difference between composite filling and inlay treatment?
I think the question is regarding for the direct resin filling for just ended one single day, and the inlay restoration, which needs a tooth visit for like 3 or 4 days. So basically, this is regarding the caries treatment, the cavity treatments. So if your tooth have a cavity or decay, we have to remove it and to put something instead of the cavity and the removing the parts. We highly recommend to the using a composite resin for that space. About 50 or 60 years ago, we used an amalgam, but it's black silver, so now we don't use it. So the composite resin for the restoration material is a good choice. However, if the cavity is big, the criteria for the using the direct resin filling and the inlay of the other treatments is if the decay or the caries is covered over the 1/3 of the tooth surface. We are concerned about that, the strength and that bonding strength and the bonding part. So in that case, we're not resin restoration, but inlay restoration. The difference between the direct resin filling and the resin inlay, for example, the strength, the hardness is more than 10 times compared to the direct resin restoration. We are relieved if the cavity is big. If you receive the inlay restoration, we are relieved. But in that case, the cavity is really big, but the patient sometimes insists to the composite resin restoration. We can do that, but the longevity, so that we call the secondary caries, the possibility for the forming the secondary caries is getting really high. So you pay the money for your caries, but after 1-2 years later, the secondary caries can be happens. So if the cavity is big, we recommend the inlay restoration. The another reason that we do the inlay restoration is if the cavity is concerning the proximal surface covered. Basically, the tooth is not just stand still; they're pushing each other. So the inlay restoration is the only way we can make the pushing power, but the direct resin filling, we cannot make that power. So if the caries is covered the surface, then the proximal surface, then inlay restoration is recommended.
So why do patients need to install crowns after nerve treatment?
The procedure for the root canal treatments, we have to make a big hole to find the dental nerve after the root canal. Even though we filled the resin filling inside, but natural tooth thickness is crucial. So if there is some crack and if some heavy force is going directly hit that thin part of your natural tooth, which is not covered the crown for your back tooth, is breaking down. So we have to remove it. The basic root canal treatment is the saving the tooth procedure. So we recommend after the root canal treatments to have to receive a dental crown treatments for prevention for your tooth breaking down.
So how long does a dental implant procedure take?
Of a dental implant, we call the osseointegration, which is binding the titanium of the dental implants is binding the bone directly. So it takes at least 3 months after the insertion of the dental implant. If you lose your natural tooth for the gum disease like swelling or the pain, we recommend to insert the dental implants for after 3 months later after your extraction. So basically, the healthy bone, we insert the dental implants, we need at least 3 months. Sometimes we can make the implant procedure just in 1 day. That's really limited and well-cared treatments.
So, are there any complications while having implants?
There are so many dental implants brands and the company in the world. So unfortunately, there is no perfect design for the dental implants. The most common complication we call the screw loosening. You have to know about the structure for the dental implants. The role of the abutment is linked to the fixture and the crown. So if the harmful force hit the implant crown, sometimes the screw that the fixing to the fixture and the abutment, a screw is loosening. So that's the most common complication for an implant. Another complication regarding the dental implant is we call the peri-implantitis. We call the implant gum disease. The gum can be swelling and the pain, and sometimes the tooth is moving, so we have to remove it. Same thing can be happen in the dental implants. Unfortunately, dental implant is artificial, so there is no immune system yet. So the breaking down speed, the damaging control is impossible. So the speed of the breaking down is more fast compared to the natural tooth. So to avoid that some kind of complications, you have to visit the dental hospital regularly.
So today we learned many things about dental implants, and the doctor explained in details everything related to the surgical dental procedure, such as indications and how can be performed. Thank you for joining us today at Cloudswell TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as we can.